Hey guys, this is Dr. Hub. Now let's look at the bronchopulmonary segments. So under the bronchopulmonary segments, there are different lobes. So there is a superior lobe. So what does the superior lobe include? Superior lobe, there is a right lung. The right lung under the superior lobe, there it includes one. We will be seeing the diagram, so it will be easier to understand later on. So one is the apical. The two, it includes the posterior. And then the three includes the anterior. So the superior lobe, there is a right lung and the left lung. Right lung, it includes the apical, the second one being posterior and the third one being the anterior. Now let's focus on the left lung. The left lung, there is let's divide them. So it includes the apical. So there is apical, there is a posterior, there is anterior. Anterior is 3, apical is 1, posterior is 2, anterior 3, and then there is also presence of 4 being the superior lingual. So 4 is the superior lingual and then 5 is the inferior lingual. So this was about the superior lobe. Now let's look at the middle lobe. So in the middle lobe, there is a right lung. Middle lobe, there is a right lung. Right lung, there is a 4. In 4, there is lateral, and in 5, that is medial. Now let's look at the inferior. So under inferior, there is a right lung. So under inferior, there is right lung. So what does it include? There is 6. So 6 is nothing but it is superior. That is apical. Next there is 7. So 7 is nothing but medial basal. Then comes the segment 8. So the segment 8, 9 as well as the segment 10. So under 8 there is a anterior basal. Then comes under 9 it is the lateral basal. And under 10 it is going to be the posterior basal. So this was about the right lung. Now on the inferior lobe. Now let's look at the left lung on the inferior lobe. The left lung, if you see, it includes the 6, 7, 8, 9 and 10. So that is in the 6, in the right lung it was apical. And here also it is going to be superior apical. So it is basically the similar ones, that is the superior apical. Then there is a medial basal. Then comes the anterior basal. Then there is also the lateral basal, and there is also the posterior basal. Now, some important things we need to note is that the apico-posterior segment, so this includes, there is a left. It includes the left segments, that is the left apical and the posterior segments. Next is we look at the anteromedial. So in the anteromedial basal segments, so this includes the left anterior and the medial basal segments. So this is important to note. Now let's look at the diagrams. It will be very easy to understand. Now we are looking at the right lung. So let's draw the right lung. So this will be the right lung. Okay. So under the right lung, there are we are looking at lateral view. So right lung under lateral view, this will include the upper lobe. So there is a upper lobe. The upper lobe, there is a apical. So there is apical. Then comes the posterior and anterior. So there is apical, there is a posterior and the anterior. Next is we look at the lower lobe. So this is nothing but the LL, that is a lower lobe. So under the lower lobe, it includes the superior, the lateral basal as well as the anterior basal. Next, when we look at the medial lobe, there is this is the middle lobe. Under the middle lobe, there is a lateral as well as the presence of the medial. Now let's focus on the medial view. So let's focus on the medial view. So under the medial view, we have the upper lobe. So upper lobe is again divided into 3 segments. So what is it? So there is the upper lobe. So it is divided into the apical. There is a posterior. So it is apical, posterior, as well as presence of the anterior. And below this comes the middle lobe. So this is nothing but the ML. ML stands for the middle lobe. Middle lobe, this is medial. Then comes the lower lobe. So in between we have the hilum as well. So this is the lower lobe. So under the lower lobe, it is again divided. So we are focusing on the right lung medial view. So let's write right so that there is no confusion. So this is the lower lobe, and there is superior, there is a posterior basal, there is medial basal, then there is also the anterior basal. There is anterior basal, there is a lateral basal as well. Now let's move on to the bronchopulmonary segments of the left lung. Bronchopulmonary segments of the left lung. So when we look at the left lung, there is now we are looking at the lateral view. So under lateral view, there are just 2 lobes. There is the upper lobe as well as the lower lobe. So upper lobe, if you see, it is similar like this, and then it looks like this, and there is a apico-posterior, there is a anterior portion, and there is a superior lingual and the inferior lingual. The superior lingual as well as the inferior lingual. Next is the lower lobe. Lower lobe, it contains a superior, then comes the anterior, lateral, and the posterior. This antral, this lateral, as well as the posterior. Now let's look at the medial view. The medial view, it is there is presence of the upper lobe. There is presence of upper lobe. So how is it divided? So there is a apico-posterior, followed by there is an anterior portion, and then there is a superior lingual as well as presence of the inferior lingual. So this is how the upper lobe. Next, we have the presence of the lower lobe. Okay. So this lower lobe has a superior portion. There is a superior posterior basal. There is also presence of the medial basal. There is presence of the lateral basal and the anterior basal. So this is nothing but the lower lobe.